how do you know if you have homocysteine issues? Well, for a lot of people, the first thing will be is that they feel inflammation, that they hurt all over. And this can even potentially lead to cardiovascular issues such as stroke and heart attack, because inflammation builds up within your capillaries and within the veins throughout your body, building up and causing everything to just slow down, your whole blood flow to slow down. And this can be very, very problematic, and you eventually have a clot and something goes and it's very bad. You don't want this to happen. And so those early signs of inflammation could be a sign of high homocysteine. Now, whether you have a fixed homocysteine rate or just high homocysteine based on vitamin deficiencies, there's a lot that you can do to figure out why you have it and if you have it. So getting a blood test is your easiest way to test for homocysteine. There you can actually look at homocysteine levels in your blood. Our CMA, the cellular micronutrient assay, the intracellular test that we do, we can also do the add-on of homocysteine testing, which is very, very helpful. So that gives you a full picture of what vitamin deficiencies you have, looking specifically at those B vitamins and other ones that potentially can cause high homocysteine levels, as well as look at your homocysteine level. How great, you can get it all in one go. Now, the other test you can do is a genetic test, like our DRP Genetics. This test is extremely beneficial for those that potentially have the homocysteine gene SNPs, as ours tests 15 or 16 out of the 17 known homocysteine SNPs. That is the genetic errors that are passed down that you potentially carry that cause high homocysteine. Now, this is what Dr. Purser talks about with the fixed high homocysteine level. If you have gene SNPs, if you have several of these gene SNPs that are homozygous, you will always have high homocysteine. And it's just fixed. It is fixed by your genetics. That's what you have. But you can work with it. You can work around it. And that's with high doses of reduced glutathione to help balance out that high homocysteine, specifically balance out the cytokines stimulated and that are produced because of that high homocysteine, as well as covering all of your methylation bases. Those are really your main options. So our MTHFR Daily is a fantastic product that covers most, if not all, of those deficiencies that potentially cause a high homocysteine level. Remember, your gene SNPs cause intracellular micronutrient deficiencies. That's vitamins, minerals, amino acids, and antioxidants. Your gene SNPs cause these deficiencies. Hopefully you can get a lot of those nutrients in your diet, but you will never be able to get everything you need because your genes are not capable of breaking them down and receiving them in your body. So you have to supplement with the right forms, like methylated B vitamins, like we talked about, with truly reduced glutathione, with the right versions of B12 specifically. If you have certain genes with COMT and other things, you need adenylyl or hydroxycobalamin and not methylated cobalamin, specifically not cyanocobalamin. And so based on your genes, we can prepare an accurate personalized guide for what you need. And so if homocysteine is one of your major problems, which we are seeing in more and more of our patients, most things tend to come back to high homocysteine, MTHFR errors, EMT errors, and those are some of the things that we can treat very readily and very easily with supplementation of those correct forms of vitamins. Get the testing done. It's your first step to really get going, and if you already have had your genetic tests, great. And if you've already gotten a CMA, maybe it's time to look again. Our vitamin levels, intracellular vitamin levels, change every 90 to 100 days, just based on the cycles of life. And so we recommend getting tested again once or twice a year and truly optimize those deficiencies that you're dealing with. So if you have any questions, please reach out to us. We are so happy to work with you, so happy to answer and just help you along this wellness journey.